We are back with Olivia Butler, the Communicable Disease Program Supervisor with the Wicomico County Health Department. And, you know, I think the reason we want to do this is because we are inundated with information, and unfortunately, not all of it is factual. So we're trying to weed it all out, if you will. So we're talking about, you know, who may get it, who may not, but this is a fast-growing they're calling it a pandemic now. So a month from now, where do you see us with the coronavirus?
Well, it's kind of hard to predict what we'll be looking like in a month with this, but I mean, we are seeing cases in the United States, so I do think probably we will have some that we will see locally. Now, what it looks like, I'm not really sure. That's why we continue to work with offices in the area and other community groups to make sure that we are getting some things in place ahead of time so that depending on what it does look like, we're ready to respond to it.
Sure, sure. And like you said before, there's a lot of unknowns. You don't know a lot about this disease.
Well, it's just, you know, where it is a new virus and who it's going to affect and how it's going to spread, and you know, it's one of those things where it gets introduced and we just have to kind of watch and see and hope people do the things that they're being told to do to kind of help us you know, not spread it.
Yeah, exactly. And that leads to our next question. You know, a lot of people, again, turning to social media, a lot of people saying that, you know, too much is being done and it's just all hype. What do you say to those people who are upset that schools are closing and events are being canceled?
Right. I would say, you know, it's not really hype. We need to be looking at the guidance that's come out, especially just the little things that people can be doing as far as washing their hands and trying to practice social distancing. If there's things that you don't need to go to, then it may be better off right now to avoid those. Especially for people that are elderly or have underlying medical conditions that would be more at risk. You know, people don't need to really be isolating in their homes at this point, but you know, just practicing those little things to protect yourself when you're out and about. You know, cough etiquette and those kinds of things is what people should be doing.
Yeah, yeah. And don't shame people for sneezing.
Right.
That's a thing now, apparently.
Everyone's afraid to.
Everyone's afraid to sneeze. Well, thank you so much. I think the bottom line is, you know, we just need to pay attention to what's going on and wash our hands. I don't think we can say that enough, can we? Yeah.
No.
Olivia Butler with the Wicomico County Health Department. Thank you so much.
You're welcome.
So let's dig into how the team at PRMC is working to keep us all healthy. We can tell you this is at the top of their radar. First, travel screenings. It helps PRMC quickly assess the risk that a patient's symptoms might be something more than a routine cold or flu. They also have something called negative pressure isolation rooms. According to the hospital, these are designed to keep infectious diseases contained. PRMC staff has been trained on isolation precautions and the proper use of protective garb. On top of that, the hospital tells us they hold routine drills on what to do if they have a patient with an emerging infectious disease, and they explore many different scenarios. The hospital tells us that their clinical staff takes part in frequent calls with local and state health departments and stays current with the latest recommendations of the National Centers for Disease Control and Prevention. And as you know, and can probably imagine, there is a lot to this situation. If you're looking for more information, and there is plenty of it, we've put together a comprehensive fact sheet and resource page. You can find it on either our website or by using the WBOC News app.